Hello, my name is Peggy Barlett from Johnson County Community College, and I'm here today to go over sterile dressing change. Now, if you had a sterile dressing change, and we usually do sterile dressing changes to central venous access device locations, which we will be doing today, they usually have a kit already prepared for you. You just take some extra sterile gloves and some clean gloves and use a sterile kit. So I will show you what a sterile kit looks like. However, we're going to do it the hardest way, and that is without the kit. Okay, so if I had a sterile kit and I was opening it, first of all, open it away from you. It's sterile. And then, as you can see in this kit, I'm just going to show you, it has a pair of sterile gloves, which I would take out first. And then I could take out the mask and put it on, and these things. And here is, I would probably put on my sterile gloves and take out the rest of the stuff. And you can lay them all out on a sterile field. But anyways, I just wanted to show you what was in the kits. You have your opsite dressing, and then you will have your ChloraPrep wand, which is our antibacterial agent. And a little advertisement here, a 2x2, a sterile 2x2, and a sterile little Q-tip thing, and that's to help because this is a sterile dressing change, they just put some extra things in there to go around. Okay, so just want to let you know what a sterile kit looks like and how we will never use it again. No, really we would use it. Actually, I'll take this. All right. Let's put this right here for a second. Okay, so I've gathered my supplies. I know I've been taking care of this gentleman all morning, and I told him that when we have time I would come in and do the sterile dressing change. Now, sterile dressing changes we've changed the rules on those a lot. It used to be every 3 days. If it was a gauze dressing, we have to change it every day. Most ask for transparent dressings, and it isn't a physician's order, it's a hospital policy, unless the physician orders something that is different from the hospital policy. So if it's a transparent dressing, that means that we can see through it and you can see the site, then we're going to go ahead and change that weekly. So I've assessed him this morning and I noticed that it was time to change the dressing. So that's why I'm returning to the room. So I'm going to knock, knock, knock.
Come in.
Hi, Mr. Armstrong. It's me, Peggy, again. You know what? We talked about changing that dressing to your shoulder earlier, and that's what I've come to do. Is this a good time for you?
Sure, why not?
All right. I'm going to peek here and look at your armband while you tell me your name and your date of birth again.
It's Chester Armstrong, 6/27/55.
All right. And are you allergic to anything?
I heard redheads. Sometimes I'm allergic to redheads.
Allergic to redheads. Well, this is your lucky day. Only a brunette is going to be taking care of you today.
Oh, that's good.
Okay. And I will tell you as we go everything that we're going to be doing. So let's go ahead and I think I might raise your bed a little bit. And let's raise your head. Now, the patient really doesn't have to be, they can be lying down, they could be sitting. I've done dressing changes as they sit in a chair, as long as they're comfortable. Mr. Armstrong, when we do this dressing change, let me just peek at this, at what we're going to be doing. And I'm going to put a towel in your clothes so that we don't get your clothes wet. And I can see, because this is transparent, I can see that there's no redness or there's no swelling. And although I don't have gloves on, I can go ahead and lightly palpate around the area. And how does that feel, Mr. Armstrong?
It feels okay.
Okay, so if that was tender when I was touching, then that's something that I should note. Okay, so that looks good. And I'm going to go ahead and, this does not have sutures in it. There's usually a suture here at the insertion site and at both little holes here in this and that, and because they're getting away from not suturing, every time that you break the skin, it's a chance for infection. so we will see non-sutured things. Sometimes they'll put a stat lock, which is a securing device, but what I'm going to do is just secure with paper tape so this doesn't move when I cleanse. I don't have a stat lock today. Okay, so this is secured. This is this way. And I'm going to have you look over to so that you're not breathing on the side or have any extra germs over on this side. The patient can either wear a mask themselves or they can turn their head the opposite way. There you go. All right, I think we're ready to go. Now I have a choice. I can go ahead and set up my sterile field and then remove everything, or I can remove it and then set up my sterile field. The one thing I need to do is put on a mask before I remove anything, but I'm going to set up my sterile field first. Okay, so to set up my sterile field, I always kind of go backwards. What's the last thing I put on my patient? And that is going to be my sterile dressing. So let's go ahead and let's open up my sterile dressing. Remember to open it away from you. It's going to try to fall off, but nah. Okay, there you go. Next, you want to open up your ChloraPrep. And once again, if I had this over here, I might open it up over it, which I don't want to go over my sterile field. So open it up away from you. We'll put it right here. Or tell you what, let's just take this off. Okay, and this is my mask that I'm going to put on, and I already put my tape on, so I think I'm okay. Let me go ahead and open up my gloves, but not all the way. Just going to take them out of the outer package. There. Okay. I'm going to put on my mask. Usually for the checkoff we use a tie mask. Just remember, if you can't remember anything about a mask, that the blue part is facing out to the sky, if you can't remember if the white part or the blue part. And there's a little bar here that goes over your nose. Now this one has little loops on, which are nice, and I'm cheating by doing it this way. Okay, and I don't need this. Now I have a sterile field here. I can't turn my back on it. So if I'm going to step back, I have to step back like this so I don't turn my back on my sterile field. Okay, clean gloves. I'm going to remove the dressing, the old dressing, with clean gloves. Okay. Right, and what we want to do with this dressing is to move it towards the patient, which is towards the insertion site, because if I move it this way, it might pull on the catheter itself and take it out. If that slides out, you can't put it back in because it would be contaminated. Okay, so I'm going to go ahead and try to loosen up the edges. Okay. Now I can also use alcohol wipes and adhesive remover on a real patient. Now here's a trick that I do use on real patients. If you can get the opposite edges and you give it a pull, like stretch it out, it will release the surface tension and it'll come right off your patient. There you go. Okay, so once again, I'm looking to see if there's any secretions, any drainage, the secretions, redness, puffiness. Okay, and we'll just put this in here. Okay, now since my sterile field's all set up, there isn't a lag time. I go right to my sterile field. That's why I like to do it this way. Okay, so I'm going to go ahead and put, now how about cleansing my hands? If I had a cleanser like this right here, that's fine. But if I have to leave my sterile area to go to the restroom to cleanse or to hit the cleanser at the door, you don't leave your sterile area. You don't leave anything that is exposed. All right? All right. All right, let's go with opening up my sterile field. Putting on my gloves. So I step back. Now I have little wet hands. Not a good thing. Oh. Okay. So we're going to be like this, won't we? All right. Yay. All right. That was a little cheer, Mr. Armstrong. Everything's okay.
Okay, good to know.
All right. Just going to leave that there. Okay, I'm going to grab the ChloraPrep. I can't touch around this package because that would contaminate. I'm going to squeeze it and crunch it, and it crunches usually. It breaks a little ampule in there and brings the alcohol and the ChloraPrep together. Then I'm going to tap, tap, tap it onto, to bring the fluid down onto my backside of my glove. Okay, at this point, I'm going to put this ChloraPrep sponge onto the insertion site and the little winged area. Do you see that that is the only place that I'm going to go at this point? Okay, so just this little area here, and I just give it a little push, and that it's really wet. Normally it's wet. Okay, so I'm going to make this a non-sterile hand and move this back. Now once that's done, I'm going to go back and forth for 30 seconds. Okay, and that is the ChloraPrep manufacturer suggests 30-second scrub. This is going to be wet and cold, and it might even sting a little bit. The alcohol sometimes when it gets into an open area stings. Of course, that would have been helpful to know before I put this on him. Okay, so there we go, 30 seconds. Once I do 30 seconds, I'm going to clean everywhere that dressing is going to go. Now you could do rainbows, you could do circles. You don't want to ever come back to the insertion site nor the winged area because that would contaminate that. So clean everywhere that dressing is going to go. All right, this is done. Now you wait for that to dry, and that's the point. You can't blow on it, you can't blot it, you can't fan it. All right, so I'm going to take this. Now at this point, I realize this is contaminated hand. I'm just going to use this to not touch the side that's going to be touching the patient. That keeps it still sterile. So there's a couple different ways to put this dressing on. You can put it on and stretch it out, which I always have a hard time with that. What I usually do is put my thumb here and hold my hand underneath it like this and stretch this dressing out over my hand like this. Then I turn this over. Now you don't want to stretch it as you're putting it on the patient because once it's on the patient then it will retract and it might tear some skin. So we're just going to put this, kind of center it on, and now you can touch this outside, and we're going to go ahead and take this flap off. And we would do this to this side too, but because it's a plastic guy, we're going to leave this on because it's hard to get the sticky stuff off, and we don't need this anymore. All right. Good job, Mr. Armstrong. You can turn your head back. Let's go ahead and get him all cleaned up here. You can turn your head back. And before I put the gown up, there is a little tag on here that you're supposed to put the date, the time, and your initials of when you change the dressing. So let's say I've written that on here. Don't write on the patient. Write it when it's on the table here. Take it off, and you want to place it so that you can still see the insertion site. So you don't want to put that over the insertion site. Okay, now you're finished. Normally we would change the ends of these and flush the lumens the same time we do the dressing. But today, we'll say we've already done that. Okay. All right, and that is how to complete a sterile dressing change. We would document then. Thank you.